Hello and welcome to this webinar brought to you today by CML Advocates Network. I'm Denis Costello, the Executive Director of the network, and today our goal is to present to you some advice and tips about how to get the most out of EHA 2020, the European Hematology Association's 25th edition of its Congress, which this year is going to be presented as a virtual event. I'm very fortunate to be joined here today by Jan Geissler, a CML patient advocate and co-founder of CML Advocates Network, a network which brings together over 120 patient organizations in 93 countries dedicated to empowering the patient leadership in CML. Jan, you yourself have been involved in collaborating with EHA for many years in bringing the patient advocacy voice into the program. How are you reacting to and getting used to the current set of circumstances, firstly, in transitioning from a presential event to a virtual one? How's that transition going for you? And what expectations or advice would you have for other patient advocates in the same situation?
Thank you, Dennis, for holding this webinar, which I think is really, really helpful. And you know, in the previous years, we had a number of CML advocates at the meeting. And of course, these are disruptive times, which bring challenges to all of us, bring challenges to people that do advocacy, to the physicians, as well as to conference organizers. So we've all not chosen that situation, but now we're trying to adapt. And I think there's a good thing and a bad thing about these things. Of course, we would all prefer to meet face to face, because that's usually for these kind of meetings where you bump into people you didn't plan to meet or where you didn't have the chance so far. That's irreplaceable. But at the same time, I think there's a big chance of holding such a meeting virtually, because more people can attend and you can actually also participate at the time that is most convenient to you. Even though there might be live sessions where you can do live questions, the rest of the time you can actually also use nighttime, or when the kids are sleeping, or when whatever your personal circumstances are, you can actually follow these sessions. So in the end, we have a chance probably for broader participation of the patient community. Because you remember, the EHA Congress had about 12,000 people usually at the Congress on site, but the participation of patients has still been homeopathic. So we actually had 50 to 60 free tickets for the Congress. People had to afford flights and accommodation at a site where prices are quite ridiculous, which is all not there this time. So I hope we have a broader participation from the CML community. That actually means you can step into a lot of very interesting science, because meetings like EHA or ASH are the meetings where you can get, let's say, first glance on top new science coming from clinical trials. And EHA has always been a bit more, let's say, non-clinical scientific and so on the ground mechanisms. And ASH in December has been a bit more clinical in the CML setting. But I think we see a lot of exciting data coming out of EHA now this week. And the good thing is it's 10 days where you can actually attend, and there's more time to look at virtual sessions. So I think there's a big chance, even though we would have loved to meet all the experts at the poster sessions and so on.
Yeah, I mean, let's just talk about the top level, I suppose, the most practical stuff that you alluded to first. First, I think it's important to note that the program is going on over 10 days, which I think is fairly suitable in terms of adapting to virtual and allowing, I suppose, participants to absorb all the content over such a longer period of time. It's important also to mention, I think, that EHA has already made available several fellowships to patient advocates who wish to attend for free. They've now closed, so now for participants who haven't registered, there's a €99 fee to register and participate, just to mention that. If we start to look into the program itself and to try and look around the program at a glance, if you like, which is available obviously on the website, the first thing I think it's important to note is that there's some sessions which are on demand, and then there are other sessions which are live. So all of the content, though, even the live sessions, will be made available on demand, I understand, until October the 15th of this year. So there's plenty of time afterwards to digest the content, if you like. Taking a high-level overview, Jan, of the the content itself from a CML perspective. What are you looking forward to, and what are what are the main sessions and the data that you're looking forward to from a top level point of view?
Well, I mean, usually the clinical sessions are the most relevant for us as patient advocates because, of course, there are presidential seminars and let's say work group sessions and so on. But quite often they're either in a different disease area, and while hematologists need to have a very broad view on many different hematological diseases because they treat patients with all of them, we as a CML community are usually very vertically interested in the very specific CML science that is being presented. And of course, I mean, you can see the hot topics that we all know from all the discussions around what's hot in CML, around therapy-free remission, in the area of, let's say, working on CML resistance, in switching therapies, of course, quality of life and all these kind of things. So we can probably look more into all these different aspects. What does it mean? Of course, what is new this year, and that's probably an effect of the difficult period we're all living in, is what does it mean in the context of COVID? And I guess a lot of the speakers, they have dedicated sessions on it in terms of clinical management, but I'm sure also the speakers will refer to it in numerous sessions where they say what has been their experience in patients that probably got COVID-19, or what kind of precautions would they take? Is there a different risk? Or are people that are in remission with CML reacting like the general population, which doesn't mean you should get COVID. It's really bad for everyone. So I think we're going to get a lot of conclusions around that. But of course, and probably you're going to allude to that later on, we're again proud that the CML community has been very active. And even though there's no dedicated patient track this year, which we had in the physical face-to-face meeting in previous years, we are presenting our data from the CML study on therapy-free remission. Very proud of that it's been accepted. And a lot of CML physicians are going to see that in the virtual program, I guess. So that's a highlight for us, of course.
Yeah, just to reference that, so the poster that has been accepted from CML Advocates Network is referenced EP1730, if you care to look it up on the website, and it's entitled CML Patients' Views on Psychological Support Throughout the Treatment-Free Remission Journey. When we look at TFR in itself and the data that may be presented and coming out during the course of the Congress, do you have any expectations specifically around what you might see when talking about TFR on this occasion?
Well, I think, of course, everybody's looking at the clinical data that is being presented, will be presented in oral sessions and in posters. But I think what we're spotlighting this year are the psychological effects about that. Because, I mean, even though the clinical effect has been looked at for years and everybody's just looking at are the curves changing in terms of therapy-free remission, and that about half of the patients stay in remission after stopping after years of deep remission. But what we are highlighting now is what is the burden on patients in all these different phases, from the decision phase before you have made up your mind whether you're going to stop after years of remission and take that more or less consideration and risk of trying something new, and then the acute phase after stopping, and then either if stopping works in the long run or if it doesn't work. What we're spotlighting, and I think the physicians that are at the meeting will learn a lot from us, is what are the fears, what are the challenges of patients doing that? Why do some patients, even though they biologically could stop, are not doing it because they are anxious, or probably they need a different type of consultation? Or how do you deal with the first 6 months after stopping treatment where you're really nervous about your results? And how do you best support patients in that period? And I think that data is really, really important. So I hope that's going to be spotlighted to all the physicians that actually attend EHA Virtual to get the CML data.
Right. I think it's important also to mention that the big day, I suppose, for CML is in fact on June the 19th, because the way the program is broken down into certain thematics. And June the 19th is the day when most of the live CML dedicated sessions will take place, starting in the afternoon, going right through until the evening, all of this European time. If I look at the titles, because we have the information that's currently available is limited to some titles, and I suppose look at the themes that are emerging. Another theme that seems to be emerging strongly in the clinical side this year is that of resistance and strategies on treating resistance in chronic myeloid leukemia. What expectations do you have, Jan, around the data that might be presented and that type of conversation?
Well, I think there will be presentations by Andreas Hochhaus and another physician from Australia, and I think there will be, of course, I haven't seen the data yet, but I think resistance is a huge issue. Even though the comfort level is relatively high with 5 TKIs in the market, there are a lot of patients which don't respond so well. What do you do, and where does bone marrow transplant still come in, and probably not cascading down through all 5 TKIs until you come to that conclusion, probably at an advanced stage of disease. And I think there will be a lot of discussion around this. There's been also a recent paper published on how to deal with resistance in CML and how to choose TKIs in what setting, and also looking at comorbidities of patients. It's a complex decision-making which needs a lot of expertise. And I guess we're going to get quite some update in the session on 19th on treating the resistance in CML as a panel discussion. So that's certainly something that should be attended live, because it's best to attend such a panel discussion live, and probably also try, however that's going to work, we don't know yet, to insert questions during the session as well to the speakers.
Yeah. There's also, I suppose, going to be data presented about the new and emerging research in, a new TKI that's about to come on the market, asciminib from Novartis, which I suppose the community is also eager to learn more about, right?
Yes. I think there's a lot of data coming there. There are a couple of abstracts around asciminib in heavily pretreated patients, the thresholds for responses, the different studies that have been conducted, and so on. So I think there will be a couple of exciting data coming out there, because it's yet another TKI. It has a different profile. It binds at a different site at BCR-ABL. So there's a lot of hope, but of course also a lot of attention on side effects and how do they compare to the other TKIs. So I think we're going to hear much more about this in the session on demand, actually, on the program.
Yeah. Also, as part of the program, there are a number of what are called satellite symposium. These are in fact sponsored by industry. The one, I suppose, that is of note to our community would be taking place on June the 11th in the morning time, 10:15 a.m. European time. It's sponsored by Novartis, and it's several expert insights into CML, and also looking at the unmet needs in CML, with a presentation from Dr. Hughes from Australia.
Yes, I think that's going to be very interesting. And also there's another presentation in the same session, which is also about monitoring how to achieve the treatment goals in CML. And I mean, as a background, just recently new guidelines have been published by the European Leukemia Net on CML. That was not there last year when we had EHA, and also not there when ASH happened last year. So I think that the speakers will discuss a lot about the new ELN treatment recommendations in CML, the milestones. which have not fundamentally changed, but there is a new category also for TFR in there. There are a couple of other updates around how to manage CML patients, which are different to the previous guidelines. So I guess we're going to hear a lot more. Usually in satellite symposium at EHA, you cannot present newest data because it's company sponsored sessions on the program. And usually they can only take a look at retrospective data, not unpublished data. But because the guidelines have been published about 1.5, 2 months ago, I think, they can all freely talk about it and discuss about it also in the satellite symposium. And I think that's very good. Usually satellite symposia are a good summary of the status quo and taking stock of where we are today with, for example, treating CML, while then later on the scientific sessions will take it further and say what's the experimental data that is coming out. And that's why it's usually quite complementary to look at satellite sessions as the status quo and then the scientific sessions for the outlook and the newest clinical data and the newest drugs and new experience in clinical management and so on.
So beyond what we've talked about, as you mentioned, I mean, the circumstances of COVID have and will, I'm sure, inform much of the conversations and the presentations by the experts during the course of EHA. But indeed, there are also a number of dedicated sessions on Sunday, June the 14th to COVID-19 and hematology, looking at the pathology, the clinical management side, as well as the future. What do you expect there?
Well, I think we're going to hear about the differences in managing hematological malignancies because, of course, there are patients which are immunocompromised, which are at high risk in case of a COVID infection, which is not the case for CML patients in remission, which usually have a normally functions immune system. So we're somewhere between the chairs because, of course, in our community, we also have patients which went through bone marrow transplant or where they are suffering from low blood counts and so on. And of course, for those, there's a much higher risk. While for others which are in deep remission, the current understanding is there is no specific risk to CML patients in deep remission, as far as I know. But they're going to discuss that there as well. And of course, I don't know whether they're going to cover it somewhere, but there are also trials going on with imatinib at the moment on the application to prevent COVID, because there seems to be kind of mechanism that actually inhibits the binding of the virus. So I don't know whether they're going to cover that at EHA because it's not got to do with treating leukemia patients. It's got to do with using the same drug that has been established in the area of CML for actually preventing that people get COVID. Let's see what role that will play in the discussions that they're going to have on the 14th of June.
Right. I mean, you've mentioned it before, you know, the pros and cons of having a virtual event. I suppose one of the cons might be, you know, the whole networking that goes on the fringes of attending such a conference when you go face to face. I mean, you yourself are very present on social media and on Twitter and so on. What advice would you give to attendees to overcome that barrier and to, you know, use the technology available to network further?
Well, I mean, the more you need to go virtual, you need to actually look what's going on social media. And of course, we have the CML Advocates Facebook page, and the team's going to keep everyone up to date what's happening at the EHA. And when the whole thing has kicked off, I think everybody will have more experience in how to use and navigate through the virtual system that EHA is setting up. So getting tips there. Make sure that you look at the hashtag that actually will be introduced for EHA, so you follow the news on Twitter. The advantage of Twitter is always short messages. You don't have to read a lot to actually get a core message, and usually there's a link in it where you can get additional information, or there's let's say a screenshot of a slide or something, and then you can actually it draws your attention to exciting news. So watch the CML Advocates Network Twitter channel, watch the Facebook page of CML Advocates, and watch the hashtag of the conference, probably combined with a keyword in CML. I mean, there are a couple of tools for social media to follow that. like TweetDeck or others which you can actually use to monitor specific hashtags or a combination of a user and a hashtag, so you can actually be aware what's going to be talked about. I think everybody probably at the Congress will have the problem because they can't discuss in the breaks by meeting people outside of the or a session room. Much more will be going on social media where people will discuss it, probably also argue about the pros and cons and say, I see this, I see that, I don't believe there's a gap. So it's going to be quite interesting, probably more intensively than we had it at any EHA before, to see how even the physicians are discussing amongst each other. And always remember, there is no stupid question for us as patient advocates. Ask your questions, retweet, reply to people on Twitter, ask for clarification, and there might be an interesting discussion emerging from that. So make heavy use of that while you're either during the live sessions or afterwards, that you know what you need to, what you have missed and what you should look at in the virtual sessions as well. The risk is always, if you have a physical meeting, you go to a meeting, you dedicate your time, you have all the pain before getting your work done, and then you fly somewhere, you're being locked into the rooms for 4 days. So you go to all the sessions, you meet all the people. But if you're at home, there's a million other priorities. So the risk is that you say, I'm going to watch that later, and never comes to that. So my advice is, follow social media and don't let too much time pass until you really look at that, because otherwise it will never happen. Quite tempting to have such a long period for watching online sessions.
Yeah, but that's very good advice, very sound. Finally, I mean, with the adapting to the circumstances this time around, unfortunately, the dedicated patient advocacy track that previously has, been integrated into the program of EHA hasn't been able to take place, which is, I suppose, a little bit disappointing from the patient advocacy community's point of view.
Yes, absolutely. I mean, that it's been kind of my baby or favorite thing that I always did at EHA for the previous years, because I really worked very hard with the EHA board and the EHA European Affairs Committee over the years to get the patient track into the program, because our goal is not to have a patient day at EHA to get patients at the Congress. Our goal was always to take the topics that are important to us as a community, which are probably not usually covered by the Congress because they're not scientific enough, but equally important. So we had our sessions and we tried very hard to get as many hematologists as we could into the room. We don't have this chance this time. So how do we make sure that hematologists are exposed to our concerns, our topics, the topics that are probably not at their main focus, but once they see the relevance. So we need to think about this. And I know that Natasha Bolaños, who's been pushing very hard and supporting the patient community, liaising with EHA actually since last year, and who's spent endless efforts to define a patient track, which didn't happen in the urgencies of this meeting moving virtual. I'm sure we're going to work on a plan jointly, and Natasha has great ideas how to make sure that we get this kind of patient and physician dialogue going now that the meeting is virtual. So we need to push hard, and we should remind everybody we're not forgetting about this. So we want that session in any other kind of shape or form.
Right. Jan, thank you so much for taking the time out this morning. I've certainly learned a lot from you, and I'm looking forward to many of the sessions now that will take place over the course of the 10 days between June the 11th and June the 21st. EHA25 Virtual is what you should be looking for on your next Google search. Thank you for taking the time also to all of you for attending and for participating in this video chat. Please leave your comments. They're all comments and questions are welcome below this video, and we will take the time to get back to you and to answer you. Thanks very much and have a great EHA.
Thank you very much, Dennis. Have a great EHA from my side as well.